Welcome to another episode of the Secure Retirement Strategies podcast. Today, Mike will talk about the bad news for your health coverage with longer lives.
So this is one of these good news, bad news situations. The good news is we're living longer. The bad news is we're living longer. And the biggest fear most people have is, will my money last as long as I do? And the next thing that they worry about is, besides running out of money, what happens if I have a healthcare crisis? And that happens really from prior to retirement through retirement. The problem is a lot of people were affected in 2008 with the Great Recession. They got laid off. They got laid off in their early 50s to mid 50s. And maybe they got a job, maybe they got a part-time job. They didn't have the same medical coverage that they had before. And because of that, the premiums, along with Obamacare, government-assisted health care, whatever name you want to give it, it's become increasingly expensive for somebody. We've heard numbers, people are paying $19,000, $18,000, $20,000 a year for medical coverage, and then they have exorbitant deductibles as well too. And how do you protect yourself against that? How do you get to the point where I've got to get to age 65 so I have my Medicare coverage? Well, unfortunately, the problem isn't going to get any better because it doesn't look like our government is really doing anything. When you hit age 65, Medicare will kick in, and Medicare's a pretty good plan. But until you have that, you're going to have to try to find some kind of government-assisted health care plan. But the problem doesn't stop. Even when you do have Medicare, as you're in retirement, you've gone from a paycheck, you've gone from getting your medical deductions taken from those paychecks to now living in retirement and having to create an income that you're going to have to live on. And because you need that income to live on, medical costs have to be one of the things. Long-term care is one of the biggest problems that we find people have. Probably about 80% of the people who we talk to have no idea of what they're going to do if they have a medical crisis. They don't have any long-term care protection. They don't have any thoughts, and they joke about it. Well, I told my kids take care of me. That's not necessarily the right answer, and that's a heck of a burden to put on your kids, especially if you really need medical help. And so how do we help that? How do we help you with that? With income riders, which have some long-term care provisions, as well as traditional long-term care policies and lump sum long-term care policies, all of which will help get you through that period, that crisis that, God forbid, if you experience, it's going to come later in life, but it's going to be devastating to your retirement account if you don't have a plan. And we're living longer, and the likelihood is that you're going to need some kind of health care. Whether it's in-home health care, whether it's nursing home health care, you're going to need something. And if you do, you don't want to see it destroy your retirement account. Because typically right now, the average stay in a long-term care facility, about 3.5 to 4 years. The average annual cost, about $130,000. So if you're in a facility for 4 years, you're looking at over $500,000 that you might have to pay. That can devastate not only you, but your surviving spouse. And any money that you may have wanted to leave to your kids may not be there. Don't procrastinate. Don't wait. Talk to us about how we can help you get through this problem. Thank you.
All of us at Secure Retirement Strategies sincerely hope that you have found this podcast informative. If you have any questions, don't hesitate to give us a call at 866-481-5211. You can also visit us on the web at srsstrategies.com. Be sure to like and subscribe to our podcast on YouTube, and you can also find this podcast in audio-only format on iTunes. Thanks.